Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Wapus. On this episode, we are joined by Vaughn Bowles, as usual, the Public Information Officer for the Menominee Indian Tribe of Wisconsin. And we would like to remind people that we request you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Hi, guys. Thanks for having me back again.
So Vaughn, this week we saw another shutdown here on the Menominee Reservation, and in one of your PSAs that you sent out from Dr. Slagle, community spread was mentioned. So I was wondering if you could give us kind of a rundown on what that is and what does that mean?
Yeah, so there are different types of way viruses spread, and we can break those down really quick. There's direct contact where there's someone that has a positive case of COVID-19. You're, within 6 feet of them for, more than 10 minutes. That would be counted as a direct contact. There's also indirect contact where someone who has a positive case of COVID-19 is somewhere, may cough or sneeze on something. You're in that vicinity a little bit later and could be exposed to the virus. There's a lower risk with indirect contact. There's also something called an iatrogenic contact where there's a healthcare facility and someone who has COVID-19 is in that facility and you could pick it up there. That doesn't happen frequently, but that is a possibility. Community spread is kind of the nebulous answer for you were out somewhere and you got it, but no one knows where you were or who the person was that has a positive case, and they can't really track it back to a specific location. So they define community spread specifically as the spread of a contagious disease to individuals in a particular geographic location who have no known contact with other infected individuals or who've not recently traveled to an area where the disease or any document cases are present. So it's basically you're out and you got it. And that happens. There's really no one to blame in those types of situations. But it is possible you could get it just because COVID-19 is pretty much ubiquitous now. It's out in the environment. It's everywhere. And so there is a possibility to get it from community spread.
Is that kind of indicative of like an uncontrolled kind of, outbreak, I guess?
I wouldn't necessarily call it uncontrolled. I mean, there are definitely a lot of random factors to it and stuff, but in cases like with what the tribe has been doing, there are a lot of people doing the best they can to make sure that, viruses aren't spread. So I wouldn't call it necessarily uncontrolled. It'd be more like happenstance more than anything.
Okay.
Yeah.
Okay. So as I mentioned, we were shut down this week. Is there any word on how long that is going to be going on for?
Yeah. So Incident
Command.
Date? Yeah, there is. Good news. There is.
Okay.
Incident Command issued order number 4, and it was to lock down the tribal reservation again. And it started on September 16th. The scheduled shutdown or the scheduled reopening, at this time is September 28th. That could be extended depending on the number of cases, whether or not they increase, stay the same or decrease. That'll be up to, our emergency management director, whether or not they want to extend it or not. But right now the scheduled date is the 28th. So we do have an end in sight.
Okay. And then I've been kind of seeing a lot of people on social media or your friends and family that they're going to places or they're traveling or they're going to events or doing things, but they preface it with, well, we're social distancing or we're wearing masks. Is that going to keep you safe? I mean, is that a legitimate
answer or justification?
Yeah, justification. That's the word I'm looking for.
So I'm going to give you the standard answer that everyone loves with science, and it kind of depends. It depends on
Your
whether.
catchphrase.
Yeah, it depends. That's my catchphrase. I'm just going to put that on my bumper sticker. And it depends. Going to get that as my new license plate. And it depends on things like where they're going. Is it going to be indoor or outdoor? How many people are there going to be? Are there going to be 10 or 200? I mean, are you traveling to a place where other people are coming from an outside community, like the powwows? People come from different states and stuff, and could be bringing various diseases, flu, COVID, different things with them. There are also other things you need to consider. If there's food, is it going to be communal, individually wrapped, purchased, things like that. Also, what's the sanitation situation? Is there going to be running water? Are you going to have access to soap? Are you going to be, exposed to restrooms versus porta potties? And then people got to take into account their own individual health. Do they have an immunocompromised situation and stuff? Or are they diabetic? Do they have high blood pressure? Are they morbidly obese? How old are you? Those are all things that can affect your likelihood of catching COVID-19 or any virus or disease in that matter. And so it really becomes, a question of how safe do you think this is? I mean, masks and social distancing and hand washing are great. It's definitely a good way to cut down on the spread of things like COVID. But it's not 100% effective all the times. I mean, if we all did that all the time, we still couldn't prevent the spread 100%. So there still is a possibility that even with social distancing, even with masks, they could contract it. Like we talked about earlier with the community spread, there's still a chance of it. So, it's out there, and it's possible that even with all of your precautions, you may get it. So something
kind of a calculated risk.
Yeah, definitely.
Situation.
Definitely consider the risk level. And also, think about who you might be around when you come back. Same type of things. You might be fine, but someone else might not be.
So with like all the information coming out the other day with the tribe shutting down, I see that the tribal clinic is going to be doing testing. Can you kind of explain how that all works?
Yeah, so the tribal clinic has fast-acting tests. They have been testing the entire time during the outbreak for the most part. They have made some changes though. They're going to be extending their hours specifically for testing. Monday through Friday will now be from 8 a.m. to 6 p.m. They'll also offer some Saturday hours from 8 a.m. to 12. And those are specifically for testing. It'll be for the drive-up people, or the drive-up testing where people will get nasal swab, and then the tests will be run. If you are going to be tested, or if you need to be tested, you definitely should call ahead to the clinic and schedule it beforehand so they're ready for you, and so it doesn't cause delays and whatnot. If you need to do so, please call 715-799-5400. They can help you out and get that all arranged. Also, if you're experiencing some pretty severe symptoms, you should go directly to an emergency room or an emergency facility. Call them ahead too. Let them know you're experiencing these symptoms and that you think you may or may not have the disease. But you'll definitely want to seek more intense medical intervention if that's the case.
All right. And then with this recent shutdown, do you think the tribe is better prepared for working virtually now?
I haven't run any official polls on how people feel about, being more prepared. I do think we have practiced this now. This is our third shutdown essentially. And so people understand how to conduct business a little better virtually at this point. So I'd say, yes, they're a little more prepared. We're working on, increasing the tribe's wireless capabilities across the reservation right now. Things are moving forward there a little slower than I would like, but they're moving forward, which is the important thing. And so hopefully, people will have more bandwidth as we go forward and stuff in the event they do need to be working remotely again.
Is there anything else you'd like to add?
We've had quite a bit of positive cases diagnosed in Shawano County recently. They have been averaging about 20 new positive cases a day for the last several days. Sheena mentioned that she saw there was a day with 30 days. I'll definitely need to go and check on that because the state hasn't updated that on their website yet. However, they've also done National Guard testing, and they tested about 475 people. About 75 of those were tribal members as well, and people that lived on the reservation. So hopefully we'll get a better idea of where our local community is sitting in the next few days regarding COVID-19. And hopefully we can end this shutdown, and hopefully the safety precautions and practices that we've all been doing will have paid off. So, stay safe out there this weekend. Stay healthy, everyone. And thanks for your help with all of this. I know it's been a real trial on a lot of families. So thank you.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them in to us via email at podcast@mitw.org.